Your community health center emerged from decades-long efforts to improve the lives of Americans, providing health care to everyone, especially those who need it most. It started during the farm worker and civil rights movements, a time when healthcare disparities among marginalized communities, especially people of color, people with lower incomes, people in rural communities, were becoming increasingly visible, and the resulting human and economic costs could no longer be ignored. Local leaders, the medical community, and the federal government knew they could do better. The partnership they formed transformed healthcare the nation over, and in time would strengthen thousands of communities and save countless lives. Their success emerged from a commitment to be relentlessly innovative, meeting people where they are and speaking the languages they speak, delivering quality care for their eyes, their teeth, their whole bodies, providing behavioral health and pharmaceutical services, forming local partnerships to address root causes like food insecurity, poor nutrition, and employment. They opened doors wide across America, strategically placing centers in rural communities where the nearest doctor could be as far as 50 miles away, caring for people who have Medicaid, for children, for veterans, for people who have never seen a doctor before, or who have no insurance or ability to pay. They delivered results. People who go to health centers see outcomes as good as or better than those of other care providers. And community health centers are showing a positive impact on rates of mortality, low birth weight, diabetes, and hypertension. And they save money. A community health center's daily cost is about 2/3 that of a private provider, saving almost $2,300 per Medicaid patient each year. In all, health centers save about $24 billion every year. And they are economic engines, generating resources, jobs, dollars, and services to hundreds of disadvantaged rural and urban communities, and generating over $60 billion in economic activity every year. $1 of health center funding delivers nearly $6 in economic activity. Health centers have risen to the challenge of saving lives and money, providing care to the people who need it most, and making their communities stronger and more resilient. Yet today, 122 million Americans still live in areas with little or no access to doctors, and the need for community health centers is still great. An investment in community health centers is truly an investment in the continued health of our nation. Your community health center, advancing equity, changing lives.